So, hi everyone, welcome or welcome back to my channel. So, we are so excited to welcome Dr. Yolanda Lenzy to the channel. And so, first, I want to say a huge thank you, Dr. Lenzy, because you all, she is on the go. She has a jam-packed schedule, and that she would take the time to invest in us and in our community is just, I have nothing but gratitude. So thank you for taking the time. Also, a huge congratulations because she's got a little surprise on the way. So we want to say kudos to that.
Thank
So
you. Thank
you know
you.
how we do, everyone. Let's put a little thank you in the comments, just to give our thanks because it is not lost on me that you have taken the time to spend a little bit of time with us to share your expertise. So thank you.
My pleasure.
The other thing I wanted to share too before we kick off is Dr. Lenzy's book, Getting to the Root book. It's called Getting to the Root, and I'm going to link it in the description box. You need to get this book today because as a patient, it was the most comprehensive book that I found in layman's terms that helped explain about 16 types of hair loss, treatment options and ideas, and patient stories, pictures. Just go get it. I'll link it in the description box below. But then we'll also have Dr. Lindsay tell more about it as we go through the session today. So anyway, so Dr. Lindsay, one of the things we like to do is we always like to hear sort of it's not just what people do, it's how they do it and what kind of why they do it. So can you tell us a little bit about your background? And you are also not only a dermatologist, but a cosmetologist, which is a really unique combination. And so, can you tell us a little bit about your story?
Sure. Well, thank you so much for having me, your patience, and getting a date nailed down. But hi, everybody. I'm Dr. Yolanda Lenzy. As you mentioned, I'm a board certified dermatologist and the owner of Lenzy Dermatology and Hair Loss Center, which is in Chicopee, Massachusetts. And as she also mentioned, I have been a licensed cosmetologist for over 25 years. So I actually took cosmetology when I was in high school. So my high school was a vocational combination college prep high school. So I always loved doing hair when I was growing up. I would do my mom's hair, my sister's hair, and even though I was the youngest. And so when I saw that they offer cosmetology, I thought this could be a great opportunity for me to train. And then I could do hair like in college and med school. And then, fuse together my passion for the beauty industry with my love of math and science and medicine. So that's what I set out to do. I had a mentor when I was in high school who was a dermatologist. She was actually my first African American female physician.
Mhm.
And I shadowed her and got a chance to see that dermatologists are the physicians that take care of the hair, skin, and nails. So we saw patients with skin conditions, nail conditions, but a lot of hair condition, hair loss. So
Mhm.
I was like, wow, I could fuse all of this together. So that's how the idea started. And then with mentorship and doing a lot of extra things, I was able to follow through on that. So and my mom developed a form of scarring alopecia that I'm sure we'll talk about, which is the
Mhm.
most common form of scarring alopecia called CCCA in Black women. And so I saw that there was a dearth of really research, effective treatments. So I set it out as a mission to work on that
Mhm.
with my career. So that's really how the path has taken me thus far.
Well, thank you, and we are blessed to have you in this field. So thank you for that. And so you mentioned it, but let's jump right in. You said in your book that CCCA is the number one cause of hair loss in African American women. And interestingly enough, even on this channel, there are women. I've looked at the data from like 40 different countries around the world that are dealing with some form of um, alopecia, hair loss, or CCCA. Can you tell us about CCCA? And then there are also some other ones. There's fibrosing that we've learned about. There's telogen effluvium, which many of us who have CCCA also sometimes there's a thing going on.
Yep.
So can you just talk to us? What is CCCA? What do we need to know about it?
Sure. So let's just take a step back first. So I always like to kind of break down how we look at hair loss or alopecia. So hair loss and alopecia are interchangeable words.
Mhm.
So if someone says, I've been diagnosed with alopecia, that's like saying you've been diagnosed with cancer, for example. You need to
Mhm.
know what type you have because they're all different. They all have different causes, therefore different treatments. So we break alopecia or hair loss down into two major categories: those that are non-scarring,
Mhm.
in which the hair follicle is not permanently damaged, and then those that are scarring.
Right.
So, what we want to do is break that down first. And then once we do that, when we look at the scarring forms of alopecia, CCCA, which stands for Centrifugal Cicatricial Alopecia,
Mhm.
because it starts in the central scalp or the crown. Centrifugal means it starts small and then it spreads outward. Cicatricial is the Latin word for scarring. And
Mhm.
then alopecia just means hair loss. So you need to know the first name and the last name
Right.
of any
Right.
type of, alopecia that you have. And so this form of hair loss was first described in the 60s. Um, and in that time, I'm amazed that until recently, there has not been a lot of scholarly research
Right.
on this condition. Every year, I tend to speak at the American Academy of Dermatology on this condition, and I do an update on the number of scholarly articles in PubMed. PubMed is
Mhm.
the
Yep.
repository for articles that doctors use, researchers, scientists use. And we're talking about there may be 200, 300. And this is compared to, I'll give you, for example, psoriasis. There's over 40,000 articles. Acne, there may be over 30,000 articles.
Wow.
Even frontal fibrosis alopecia that you
Right.
just mentioned, which is also a form of scarring alopecia, that one now has a couple thousand. And that
Wow.
just got discovered in like 1994. So it just goes to show this is an area where we need a lot more research. And
Mhm.
excitingly, there are people who are devoting their careers to this now. So that's very, very, very exciting. And I am excited that in the next years, we're going to have more and more data and more information that we will be able to share. But we,
Mhm.
we know quite a bit about it now. And probably the biggest discovery that
Mhm.
came out was probably in 2019. My colleague Amy McMichael and some others, they discovered a gene
I
that's
saw that.
actually mutated, yeah,
I
in
saw that.
this condition called PADI3, PADI3.
Mhm.
And PADI3 is a peptidyl transferase that is responsible for how the hair follicle folds. And
Mm.
so 25% of the people with CCCA that were studied had a mutation in this particular gene. So
Mm.
this is huge because this is the first kind of like genetic connection that we found, and it wasn't everyone. So we
Right.
know it's multifactorial, meaning
Right.
it's a number of different factors blending together. It's not just one thing.
Right.
And so I think the biggest um, mishap or mistake over the past 10 years was kind of like saying it's all your hair care practices. It's not,
Right.
because there are people they're men, for example, who have CCCA and they never did any of the hair care practices that a lot of African American women do, meaning they never had a relaxer, they never used a lot of heat,
Mhm.
they never had braids, a
Right.
lot
Right.
of those things. So that's how we know that it's multiple factors. So yeah, so really exciting, to do more, delve more into that gene and others, because
Mhm.
we're just at the tip of the iceberg and figuring out what is
Mhm.
going on with it. So with that condition, the most important thing I like to share when I'm on platforms like this is to get a diagnosis early. And the reason why is in scarring alopecia, there is permanent destruction of the hair follicles. So patients often say, well, I can't grow that hair back. Not in the areas that have been scarred, right?
Mhm. Mhm.
Scarring means that if we were to take a sample of your scalp in that area, the hair follicles are no longer there. So
Mm.
this is the one thing I get so frustrated about on social media, because people will show these pictures of scarred scalps and say, buy this oil, buy this, and it's going to grow your hair back. And I'm like, how? Where is it coming from? So we have to think about
Right.
science, right? And
Right.
so if there's no hair follicle there, there's no growth. Now,
Mm-hmm.
the areas around it, that's where what we're trying to get to grow. And
Mm-hmm.
we're trying to stop the process, the inflammatory process. So I've been really trying to get the message out about that,
Mm-hmm. Mm-hmm.
that we need to stop the inflammation because that's what causes the scarring to happen. And we're still trying to figure out what causes the
Okay.
inflammation. Some people feel like their diet makes their inflammation worse. I have some people who eat clean and they still have inflammation. So it's not
Mm-hmm.
one thing because I
Right.
I'm in a lot of groups and I hear
Right.
people talk about
We're all,
just clean up your diet. I'm like, clean up your diet and
yeah,
it's not
right,
one
right.
thing. So if you just take something away from this, it's not one
One
thing.
thing.
Because I have people who eat clean, vegan,
Mhm.
all kinds of
Right,
things,
right, right.
lean protein, do all the things right, and yet they still have
Have
progression of the
something.
condition.
Right,
Yeah.
right.
So like I said, we still need to do more research, but in my experience, the people who do the best are the ones who get a early diagnosis, they get an effective treatment plan, and then they stay on a maintenance plan. So I've been,
Mm-hmm.
posting a lot about that lately because I've been helping people grow their hair back or helping
Mm-hmm.
people stop the progression. Then they go, "Oh, I stopped everything because my hair was doing great." And I'm like,
Mm-hmm.
it doesn't work that way. This is
Mm-hmm.
a chronic condition that's going to really need lifelong treatment. It may not need all the things we're doing right
Right,
now, but we
right,
need to get something, and it doesn't go away. It's like brushing your teeth. You
right.
have to keep brushing your teeth to get the benefits, not a one-time thing. So those are the kind of things that I like to share about it.
Mm-hmm.
But the most important thing is to get a diagnosis, and how does that diagnosis happen? Many times we can diagnose it clinically by photos. Like I tend to share a brochure like this in my office. This is
Mm-hmm.
from it's now called the Scar and Alopecia Foundation, but I helped to do this brochure years ago. And it
Okay.
shows
Yep.
pictures. It shows like early, then it shows like late, then it shows like how sometimes it can be an apart line and get wider. And
And
then
those are
sometimes
all me. I had those.
all those, yeah,
That's where I was until it kind of reversed, not reversed, but anyway,
yeah,
remission. Is it is it
right.
is it safe to call it remission? Because that's how I.
Yes, it can
Okay.
go on, it can definitely go on remission, but I'll always make sure people understand that remission, just like cancer, right?
Good.
So that's a good example. Like someone could have breast cancer go into remission. That doesn't mean it can't come
Right.
back in
Right.
2 years, 5 years. So you have to be
Be
doing your
mindful.
monitoring. Just like with
Yep.
breast cancer, you got to get your mammograms.
Yep.
With this, you need to be coming in to get your checks. So we take pictures on all of our patients.
Mhm.
So I've been here at my own practice for 10 years. I have 10 years of pictures on patients that I
Mhm.
saw from 2014 to now.
Mhm.
And
Mhm.
so we can see the ebbs and flows that happen over time. So that's why it's super important to make sure you have a good relationship with a board certified dermatologist, preferably one that specializes in hair loss. I know there are not a lot of us.
Mhm.
So sometimes you may have to travel or work with someone in combination with someone else. Like I have people who come see me and they live somewhere else. So I'll kind of see them once a year, give the game plan, then
Mhm.
their local
Mhm.
dermatologist might do the treatments.
Oh,
So
that's
we
good.
work we
That's
work
good.
with people, based on the situation and where they are, because there are not a lot of people that, and I see that a lot in the groups. People say I can't access.
Right.
Access to
Right.
someone is a big issue, and it's just something we're working on. It's it's
Mhm.
it's it's
Mhm.
a thing. We know it's a
Right.
thing.
Right.
It's a
Right.
thing, but you know, um, I traveled to New York to buy my wedding dress. I don't live in New York. I
Right.
wanted to go to
Right.
Clydesdale, so I went there. So it's like,
Right.
hey,
Right.
I'm worth it.
Right.
So
Well, exactly. And I think that's a really good point because I think you're the first person who I've talked to who I've heard of people doing things remotely and virtual, but the idea of maybe coming to you for the initial, as a sort of an anchor to their
yeah,
treatment plan and then seeing someone local is a great idea. That's
yeah,
a really good idea. Of the inflammation piece, because that's one of the questions, if we can go like a little bit deeper, because one of the things that I see on our channel, a lot of people talk about, and I've had experiences as well, when the itching happens and the burning happens, like what is actually going on?
Yeah,
Um,
that's a great question. So let's go back to how we diagnose it. So I mentioned, sometimes we can see it just clinically, but sometimes we do something called a biopsy. So a biopsy is where we take a sample of the scalp, we numb it up, like
mhm,
the dentist does with a little needle, burns about 15 seconds. So we take a little sample, we send to the pathologist, and they look at it under the microscope. So there are certain criteria that the pathologist needs to see in order to diagnose various forms of hair loss. So with CCCA, for example, there's a form of inflammation called lymphocytic inflammation. So those are lymphocytes. Those are cells, white type of blood cells that are produced by our bodies in different situations. When we're sick, our lymphocytes increase. When we are going through different things, they can increase. But in scarring alopecia, they are around the hair follicle and they lead to the destruction of the hair follicle, and that destruction creates scar tissue.
mhm,
So we tend to see a correlation between when patients have symptoms and the inflammation, those lymphocytes being elevated. Now, some patients don't ever have symptoms,
right.
and yet it still progresses. So that's one of the biggest learnings that we've had. When I was in residency, we really only treated people aggressively if they were itching and burning.
Mhm.
But I have patients who don't itch and burn, but yet they come back and it's bigger. So
Yes.
symptoms are just one indicator, but I say CCCA could be the silent destroyer of
Mhm,
follicles. You don't have to always have um, symptoms that you can feel. So
mhm.
that's why I take photos on all patients, because I don't remember what your scalp looked like three,
Right,
6, 12 months ago. You don't either. So,
right, right.
but I pull up my iPad and I can go to this date, go to the day, compare side by side comparison. And they're like, oh my God,
Mhm,
really?
mhm,
This is my scalp? Yeah. And so that's kind of how we think about that. So I think it's a good thought to say the itching and burning is the inflammation, but that's just a portion of it, because like I said, I still see people who progress despite having no symptoms.
mhm. The pathology report, because I did have a biopsy,
Yep,
and it
great.
said in my diagnosis was early scarring alopecia.
Yep,
And I think I was talking to someone else, and we were talking about there were a lot of us who have had for years what we've called a stress spot. It might be a little tiny, tiny, tiny thing that we've had for years. Then something happens, and it's in that spot. Like it's not like in the center, but it was like a spot, and something happens that maybe triggers a flare up or that. But the on my pathology report, and I talked to my doctor about this briefly, I think it was differential diagnosis because there was
yep,
telogen effluvium because
yep,
I know that I have experienced stress related. I feel like it goes hand in hand.
yep.
But what is a differential diagnosis?
Sure. Actually, I have a pathology report that I have in front of me that I just got back today, and I'm going to see if it gives one. Yeah, it does. Okay, perfect. So this particular person, this is just the bottom line part. It says this is consistent with a less active lymphocytic scarring alopecia, including given the clinical suspicion CCCA. Additionally, there were findings consistent with a superimposed component of androgenetic alopecia. So that's what we often see. That's female pattern
Mhm.
thinning. So a lot of patients will have
Right
two
here.
diagnoses. And it can happen right in the same spot. So if I
Okay.
saw this person, this
Hmm.
one right here,
Hmm.
you can't look at this and determine if this is CCCA or androgenetic
Right.
alopecia. You would need a biopsy. This person's more clear. I
Right.
can clearly see the scarring.
Okay.
So it really depends on where you fall in the spectrum of these, and when you present, right?
Hmm.
If you
Hmm.
present very early versus very late. And so you mentioned telogen effluvium. That's one of the non-scarring forms of alopecia. So they wouldn't see these features that you see with
Okay.
CCCA. It will be, they will look more at the count. So it's really fascinating. So the pathologists, they will count the number of terminal hairs, vellus hairs.
Hmm.
Vellus hairs are the small hairs, terminal hairs are the are the fully formed hairs, and they do a terminal to vellus ratio. So this
Mm,
it's a whole thing. It's like
fascinating.
it all has criteria.
Yeah.
It's not a pseudoscience. It's a real science. Like
Right.
to this, and like everything has criteria. Sometimes they don't see all of the features, so they may say it's non-diagnostic, but
Mm-hmm.
given this, we suspect early CCCA.
Mm-hmm.
But they'll give, so that's how the pathology report gives a lot of information that helps us, to, and sometimes I'll tell patients, okay, well, it was non-diagnostic, but because they saw some lymphocytic inflammation, I want to start you on treatment for CCCA
Mm-hmm.
because we don't want to miss this,
Right.
and then see you back. And then sometimes I may rebiopsy them later. Myself personally, I had a biopsy done when I worked at my previous practice
Mm-hmm.
in say like 2010, and then no, 2012. Then I started this practice, and then I noticed an area that was like breaking, so I had my PA do a biopsy again, and then it showed CCCA. It's like one little area back here. I can't even.
Oh, I didn't know you. I didn't know you.
Yeah,
Wow.
so I have a post way back on my Instagram, showing the
Wow.
specimen and showing like the area of breakage, and I had
Mm-hmm.
my stylist to take a picture of
Mm-hmm.
what it was looking like. And so yeah, so because I was suspicious,
Mm-hmm.
typically if a person has one spot, like you mentioned, that's
Mm-hmm.
not growing well, it was itching more than the
Mm-hmm.
rest, you gotta be suspicious.
Mm-hmm.
Even though that first biopsy didn't show, because this is all a time period, right?
Right.
So early, it wasn't enough features yet. It hadn't fully formed. But
Mm-hmm.
later, a couple years
Mm-hmm.
later, there were more features and they were
Mm-hmm.
able to
Mm-hmm.
diagnose it. So yeah, so we sometimes we do a rebiopsy after some time, and that can be very, very helpful.
Mm-hmm.
So yes, I just like to
Okay.
bring these things up because sometimes patients will come and say the biopsy didn't show anything. And I'm like, well, give me the report, because the biopsy
Right.
always shows something. They type something up, something
Right.
they're
Right.
going to describe what they saw. It might not be diagnostic of X, Y, or Z. It may be like showing signs of early this first that.
Right.
There's always something there.
Right. 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 So
Yeah.
one of the things you had said, well, I say this, and I'm in your, for those of you who don't know, Dr. Lenzy, there's a CCCA Facebook group, right? That, are you associated with that group?
Yeah, I
You
post
know,
in there sometimes.
okay.
Yeah. Hmm.
So in that group, and there are a lot of us in there, and everyone's sharing their ideas. And I personally, as someone who has CCCA, and I'm not a physician, everyone knows this, I'm not selling any oils, I'm not giving any treatment options. But, and one thing that I think is important for us is to get as much information and knowledge as possible, truth. So can you talk to us? What does it mean if it says something is burnt out?
Sure, absolutely. So it basically means that they didn't see any active inflammation at the
Okay.
time.
Okay.
So when someone gets diagnosed with CCCA, the pathologist will say there is mild, moderate, or
Hmm.
heavy inflammation. Or they may just say, I just see scar tissue, meaning I don't see any signs of active inflammation. I just see scar tissue. So we would call that burnt out,
Okay.
meaning the condition doesn't seem active at the time. Now that's just at that time.
Right.
Because as
Right.
we mentioned with the breast cancer example, you could be in remission
Okay.
now and
Mhm.
then it's not burnt out anymore. Then
Okay.
you come in with a flare. So that's why I keep all of my patients on a maintenance plan
Hmm.
long term, because you don't know when you're going to have a flare.
Hmm.
And
Hmm.
the people that I find that remain stable, they
Hmm.
are ones that are stay on a maintenance plan.
Hmm.
Yeah.
And I'll say for mine, and people, I'm not going to show my pictures. I'll show you after you see.
Hmm.
But for people that, I had my dermatologist gave me, mometasone furoate as a sort of the topical steroid.
Yep.
And so I essentially keep that on deck. I don't
Yep.
use it regularly, but if I sense something
Yep.
happening, or like I had when I got COVID,
Yep.
I had a flare. I had a flare up,
Yep.
and
Hmm.
it didn't go all the way back to where it was, but then I kind of kept that option on the table
Yep.
for, so yeah, that's important for us to have.
Absolutely. Yep. And I've had I have people who do that. And then lately I've just been having people, ones that especially I know the ebb and flow, I'm just like, just use this once a week. Even if you
Mm-hmm.
don't feel anything, just use it once a week,
Mm-hmm.
just as
Keep
an
it.
insurance policy,
Mm-hmm.
because I just see so much regression.
Mm-hmm.
That and this all has come from me. I've been a dermatologist now for like 14 years, and I've probably treated thousands of patients with various forms of hair loss. So as a result of, that's why we call it the practice of medicine. As I've seen more and more patients
Right.
back, I realize, okay, let me just do this. I
Mm-hmm.
change things up because I definitely see a difference in, you know, people who stay on maintenance versus don't,
Mm-hmm.
So yeah,
Mm-hmm.
we take it definitely on an individual basis, but that has been the biggest learning that I have done of late, and
Mm-hmm.
it's been very
Mm-hmm.
helpful for
Yeah.
people.
And so when it comes to finding a doctor, right? So you in your book, one thing that stood out to me, and you were talking about your hair care, your treatment options. I can't
Mhm.
remember the chapter, but you were very clear. We as patients, we have the opportunity to ask the right questions. What are your recommendations for us when it comes to finding the best doctor for us and getting the most out of that experience with the physician?
Yeah, I mean, I would say first do your research. And find someone that you feel like is well equipped or well experienced with taking care of the problem that you have. So within dermatology, just within other fields like law,
Mhm,
example, my husband's a trained lawyer, but he does business. So there are people who do family law, there's people who do criminal law, there's people who do business law. So I had a business lawyer when I started my
mhm,
practice. Just same as dermatologists. There are dermatologists who specialize in psoriasis, skin cancer, eczema, acne. Then there's
mhm.
those of us who specialize in hair loss. Now, I know everyone's not going to probably have access to someone who specializes in hair loss, but if I had my druthers, if I was
Right.
dealing with hair loss, which I have, I want to be treated by someone who has the most experience with that. So you can do research on that. You can see if they published. You
Mhm,
can go to PubMed, put them in there, see if there are any scholarly articles that they have written. Some people find me that way. They say, I saw you authored this article on nutrition and hair, for example, and
mhm,
so I want to see you. Or you can go to their reviews and see what
mhm.
other patients have had to say. So these are things that you can do. But for some people, they just need to see someone,
Right.
right, and get started.
Right.
So,
Right.
so there's as we say, there's levels to this.
Right.
There's certainly
Right.
levels to this. So yeah, so I
Right.
would say don't, not see someone just because you have found the perfect person. You can always switch. But that's, so Google, we have Google now.
Yep. We
It's
got.
our friend. We can do a lot of research from the comfort, of our homes. And so that's something. And then, you know, most of us in this community, like I said, we speak, we write,
Mhm,
we publish in this area. So
mhm,
it's
mhm.
pretty, easy to see who are the people who are like putting out the knowledge
Right.
and doing the research.
Right, absolutely. This is a reminder, everyone, get the book because that book, when you go to your physician, whether it's Dr. Lindsay or the next person, it's literally a phenomenal resource to help you in terms of asking the right questions. So you talked about nutrition. Let's go there. So nutrition and hair. What I loved again was that you talked about the benefits, the impact of nutrition on our hair, and it's one of the things that I think has made an impact for me in terms of, for me, it was eliminating the things that I know was just not helpful for my gut, right? But you also talk about, so can you talk to us about nutrition and hair, but then also you have a really clear definition on how biotin may or may not help. And then also you talked in your book about vitamin A and overdosing on that. So that's a big question, but can you talk to us about nutrition and hair, please?
Sure. So, I think nutrition is important for all aspects of our life. The challenge is we don't have a lot of data on specifically the impact of nutrition on CCCA or this condition. So, what I tell my patients is it's always a good idea to clean up your diet, right? I don't have the data to show this going to help necessarily your hair, but it won't hurt it, right?
Right.
And it's going to make your overall health better.
Mhm,
So if you find that when you consume inflammatory foods like, say, dairy, like, say, white potatoes, rice, um, red meat for some people, and you feel worse, then you don't have to eat those things. You can have something else. And so I don't say just do that in the absence of things that we know are evidence-based, because I try to practice evidence-based medicine, meaning the things that I recommend have been studied, right? And studies are important because the placebo effect is strong, right? So the placebo effect is when you attribute something to one thing, but it could be from something else. And that's how studies are designed, where one group gets the intervention, one group gets something that looks like the intervention, but it's not. And so you can tell the difference between the two. So that's what we need. We need more studies that are like placebo trials, where you can compare the two groups. How are they different? What did they do differently? So I definitely advocate that. So for nutrition, so I just say everyone should always strive to, even if it doesn't necessarily help your hair, it'll help maybe help your skin, it'll help your cardiovascular system, it can help your gut. So just do it, but I hear people say, I'm just doing that, and I find it sometimes that's not enough for some people. So and then you mentioned biotin. So biotin has actually come, we've have a lot of data on biotin now, and we always say biotin has a great PR agent, because if you go on any blog, people say, take biotin, oh, biotin. And so when you look at the data, biotin is pretty much helpful if you have a condition called inherited biotin deficiency, which happens in 0.000001% of the population. And it will be diagnosed at birth, and you would have like short, brittle hair. And the majority of us are not biotin deficient, but excessive biotin can cause problems. So the FDA actually put out a warning that excessive biotin can alter your lab results. So it can cause your thyroid function test to be abnormal, even your cardiac lab. So there was a case report of someone who was having a heart attack, and they were taking excessive biotin, and the test showed that their cardiac enzymes came back normal when they were actually having a heart attack. So they should have been elevated, but it was the biotin that has shifted things. So that's huge. That is really huge. So if you are taking biotin, you should probably stop them like a week before you have any type of labs done. But there's no data that it necessarily helps anyway. So I generally have people stop mega doses of biotin when they come in to see me, because they need to be on other things that we know are effective. And then you mentioned vitamin A. Yes. So one of the things we know that there's a medicine that we prescribe for acne, which is a vitamin A derivative that can cause some forms of hair loss. So we know there's something called hypervitaminosis A, which is like excessive vitamin A, that can cause hair loss. So whenever I'm looking at ingredient lists and I see that they have mega doses of vitamin A, I'm like, why? Why is this here? Yeah. So this is why we study, right? This is why we study these things, so that we can be able to divide what is helpful and what is harmful. So at least I would say, like with the nutrition, it might not help, but it won't harm you. For those vitamin things, they can actually harm you. So there's different litmus tests for when you're deciding to take something. Whether it could just be neutral, may not help, may not hurt, but you don't want to take something that could harm you.
Correct. Two questions from the audience that someone had sent a couple of a few weeks ago, because I told them that you were coming. And so a couple of questions. Before we go there, though, is there anything else about CCCA that you think, or, general alopecia issues that you think we should be mindful of, be aware? Are there preventative things? I think the obvious one is getting professional medical board certified treatment. Anything else that we should know specifically?
Yeah, I would say regarding the whole issue of the hair care practices. So, like I said, 10 years ago, that's where most of the focus was avoiding certain hair care practices. And while the data on that is sketchy, I do think we need to be mindful of how we style our hair and to do things in moderation.
Mhm.
And I always give the example, just like eating fried chicken. You can't eat fried chicken every day. And I don't think wearing our hair in, especially styles that put weight and tension on our scalps, like braids all the time, tight locks, long locks, anything
Mhm.
heavy, I don't think that is helpful, and it
Mhm.
can be actually harmful. So what I tell patients, if you get braids, you want to only have them in for shortest period of time, like 3, 4 weeks, and then you don't want to put them right back in. Because a lot of people who wear braids, for example, they have them in, they take them out, they put them right back in, take them
Right.
out, put them right
Right.
back. So their scalp is never without, and we're talking about added hair
Right.
braids.
Right.
It's never without any added weight.
Mhm.
And I don't think that's in my experience of seeing thousands of patients with this, that's not healthy and helpful.
Mhm. Mhm.
So, I enjoy braids when I'm going on vacation or doing something,
Mhm.
and I'm probably gonna get some for my birthday coming up
Right.
for a few weeks, just to kind of look, I'm gonna be busy. So, but we use that because a lot of people say, I don't want to deal with my hair.
Right.
And, putting the hair away so that we don't have to deal with it is
Mhm.
it's a mindset that can be harmful.
That's
So
good.
it's called hair care, just like our body care. We have to take care of our skin. We have to take care of, our nails and just all of the other things in our body. Same thing. We have to take care of our hair. It needs to be cleansed regularly,
Mhm.
um, and cared for. So I would just say that. I would just say definitely be mindful of excessive or repetitive or heavy any types of styles like
Mhm.
that. So
Mhm.
just do things in moderation, switch it up, figure out something that is not going to potentially worsen your condition.
Mhm. Mhm.
Mhm.
And there's some of us who would love to get dye. I'm not going to do it, but because
Mhm.
the Grays are in charge now. But I was told that I could possibly do it, but I chose not to. I'm just gonna stay away from any type of even rinse at this point. Do you have any thoughts about that? And then also maybe wigs, because sometimes wigs, some people who have, especially those who have already lost a significant amount, they're doing that. And then okay, and this is my last thing. Not my last thing, but the idea of I've seen a lot of things on the internet where the woman has CCCA or some type of thing, and they're putting the glues and the different things. And I'm like, so what should we be doing? What should we be doing?
Yeah, so with regards to hair color, I try to work on my patients and not make anything always restrictive. I say, let's see how you're doing, how you are doing, not
Mhm.
your friend, not someone else that I'm not treating, but
Mhm.
you. If you are doing well, we haven't had any signs of inflammation, we don't have any symptoms, haven't had any progression or growth of the spot. I'm okay with them getting color with a professional
Mhm.
when their scalp is under good control. Now I say professional because I think these services require training. I don't think it's
Right.
something you should just go to the store and slap on yourself because you don't know what you're looking for. You don't know the litmus test of like how long to
Mhm.
process and things like that. So that's what I tell my patients. And a lot of them choose like you not to do it, but some people it's a nice reward for them over time of 2 years of stability,
Mhm.
for example. And yeah, you can get some color that makes you feel good.
Mhm.
With regards to wigs, we definitely give a lot of advice around how you need to care for your hair and scalp underneath the wig
Right.
because um, a lot of people are in the mindset of covering it up and they're not treating it at all. There are some stylists who just do camouflage styles.
Mhm.
And while they do these beautiful transformations, it doesn't appear that the person is actually having their underlying condition treated.
Right.
So, and if you keep doing that, you're not going to have hair to cover it anymore because it's
Mhm.
going to grow. So you're doing like this like comb over thing, which is cute. It's like in a mold, it looks really nice, but 2, 3, 4, 5 years keeping doing that and the condition is growing, you're
Right.
not going to have that anymore to cover it with.
Mhm.
That's why I titled my book, Got to Get to the Root
Root.
of what's going on and get an effective treatment
Right.
plan, and then maintenance.
Right. That's perfect. Thank you for that.
Mhm.
And then we have two questions and then we'll close up. We'll close up. So the one question was, are you familiar and what are your thoughts with she said the Capiderm hair loss therapy treatment, Capyderm, Kapy? I'm not familiar with it, but are you familiar with it? Is it
Yeah, I mean, I've definitely seen it. I have not seen any evidence-based, like
okay?
scholarly articles published on it. So I try
Okay.
not to speak about anything that I can't speak about the data, but
Okay.
some people like it. So, when with things like that that I don't think is harmful, I say, yeah, sure, you
Right,
can
right.
try it. But in terms of, I try to, limit my
Yes.
endorsement or not endorsing things
Yes,
that are
yes.
evidence-based. Yeah.
Okay, okay. And then the last question from the viewer is, and this is, you have a huge fan, Tracy Dawson, 5898 is her name. And she said, Dr.
Um,
Lenzy is fantastic. And she would love to hear your opinion about the recent clinical findings related to Brepositive. I
Oh,
tried to,
brepocitinib. Okay, I
oh,
think this is
thank you.
this is a JAK, like a JAK inhibitor. And
Okay,
so,
okay.
there was a study published, a case report by Dr. Kindred that looked at baricitinib, which is a similar one, and she treated a patient with CCCA and had great results. So I think we need to do, more studies. I think they're studying this particular one in New York, the brepocitinib. And so, yeah, like I said, this is an exciting time because we have these new molecules out that we are now trying for different things. So, I would say stay tuned.
Okay.
Get linked up with a dermatologist who has access, who's on a cutting edge, and we're going to see. So it's a very, very exciting time. But like I said, baricitinib, this was just one case report.
Mhm,
So we still need to,
mhm,
study it larger. And I'm sure people are doing that
mhm.
as we speak, but the data is not out yet or
Okay.
not published yet. So, because I keep abreast on what's
Right.
published in this area, I get alerts
Okay.
on
Okay.
it. So, haven't seen anything besides that. But I think it's just, like I said, a great time to be in this area. I think in the next 5 years, we're going to see a lot more innovation. And this is what I would say to brands: invest, do
Mhm.
clinical trials of your product because that's what we need.
Yes.
It's worth it. It's worth the money. It's worth the time. Because I think for so long we've endorsed things just
Hmm.
on whatever, but we need
Hmm.
data. We really, really need
Hmm.
data.
Also, for those of us on the other side, we also need to participate in the
Yes.
trials, and we need
Mhm.
to sign up for the things. I tried to sign up for one a while back, but travel and all that. But just for those
Okay.
of us to be open to participating, because our experience can help, the
Yeah,
other.
and I know there's been a lot of mistrust with trials, from historical
Yes.
things that have happened. And this is why it's important for there to be diversity in medicine, in research, so that there's a level of trust
Hmm.
that if you look at the principal investigator and they look like you and they care, you have a sense that they may care a little bit more about
Hmm.
this and really want to make a difference and get the information that makes it more comfortable,
Hmm.
to participate, in a trial. Because that's how we learn. That's
Hmm.
how we advance the science
Exactly.
is clinical trials. Yeah.
Exactly. Exactly. I appreciate your approach and your care and your what I would call holistic. People sometimes say holistic as it's all natural. And to me, I say holistic is all. It is the
All of it. It's
professional,
all the
it is
things.
the dermatologist, it is the supplement with your I mean, I think it's the whole package. And I think that's what resonated the most to me in your book is that you looked at the whole experience, and that's what I call holistic. And for the woman right now who is scared, who is unsure, who is suffering, and who is struggling right now, what words of wisdom or encouragement could you give to her?
Sure. I mean, I get it. I mean, my mom is my inspiration, and she often says, "Wow, I wish I could have gone to a doctor like you in the '80s when I was a little girl." So
Mhm.
And I say I get it because so many people have gotten bad information, misinformation, not enough information. And I would say give it another shot. If you've gone before, give it another shot.
Mhm.
We know a lot more now than we did 10, 15, 20, 30 years ago, even for people my
Mhm.
mom's age who went to dermatologists years ago. So I would say that. I would say um don't waste time trying things that are unstudied because we always say this time is precious follicles. So in the 6 months
Mhm.
that you're trying X treatment and you haven't gotten a diagnosis and you haven't gotten evidence-based treatment, your condition could be progressing.
Mhm.
And so we can't get those follicles back.
Mhm.
And so I would say that, and I would say, tap into some of the resources that are out here. The Scarring Alopecia Foundation has wonderful support groups
Mhm.
for scarring alopecia. The National Alopecia Areata Foundation has support groups. And so it's a lot of really quality resources out here now that we didn't have years ago. So I would say tap into things that are, are vetted
Mhm. Mhm.
things that are because there's a lot of people, you know, promoting things that don't necessarily have evidence behind them. So
Right.
you
I
hear
know.
me. I'm just like
Right.
evidence based.
Right.
Come
Right.
on,
Right.
because it's just
Right. Right.
it's no other way to really tease out all of these
Mhm.
different things.
Mhm.
You have to do the studies. And so people
Mhm.
say, well, my product is great. Okay, do a study, pay for it. It's there are people who you can go to them and do a study and you can get a paper out that
That's a
shows,
really good
you know,
idea.
so but people don't necessarily want to do that.
Right. But
So
no, but I'm like, that's a fabulous idea
yeah,
to actually, anyway. So, but thank you so much. Thank you for
yeah.
your time. Anything else that you'd like to share, or where can we follow you for those who may not be following you, or
Sure. I'm probably most active on Instagram, and my Instagram handle is at Dr. Yolanda Lenzy, which is my name all written out. I'm sure
Mhm.
she'll put it in
Yep,
the
I'll put
in
it in
the
the
notes.
box.
Yeah, so you can follow me there. I do a mixture of hair loss, dermatology, and lifestyle content about my
Mhm.
life because I find it fun to follow people that I learn
Yeah.
about them in multiple dimensions. So yeah, you can follow me over there. And I typically offer virtual consultations. Right now, I'm on maternity leave.
Yeah.
Due with my first baby in a couple weeks, but I'll be back in the summer from that experience back in the office and probably back doing virtual. So you can, definitely reach out. But in the meantime, find someone.
Mm.
There's a couple resources I like to share. One is called
Yep.
blackdermdirectory.com. And one is called Docs for Hair, DOCS, the number 4hair.com
Hmm.
that my friends Dr. Chama Osei Tutu and Dr. Mina Singh run.
Hmm.
So yeah,
Hmm.
so there's a lot you can search by zip code and you can do your research from there.
Yep. Yep. And I will definitely link those in. I've shared them out before, but I will continue to share because the beauty is we do have resources. And so thank you so much. Thank you so much. So everyone, please again send a little thank you to Dr. Lenzy. And as always, live well, live blessed, nourish your crown, and I'll see you in the next video.